I'm Anthony Yeung. I'm the Senior Associate here at Desert Institute for Spine Care. I'm particularly proud of the fact that in the past 5 years, since my son joined me and since we added Dr. Field, we can offer the full spectrum of spine care for painful degenerative conditions of the lumbar spine. We have techniques that instead of treating the X-ray and the MRI, we can identify where the patient's pain is coming from, perform injections, diagnostic as well as therapeutic injections to identify the source of the pain. Then, with the aid of the endoscope, look at the pathoanatomy and find ways to treat the pain without having to place the patient under a situation where they need major surgery. What motivated me to really specialize in spine was because of my mother's condition, and I felt there was something better than traditional surgery to treat the condition. When I was a resident, my mother, who was a small woman, had a central disc herniation with canal stenosis. She underwent traditional surgery that actually caused her spine to be unstable, and it slipped to a grade 2 spondylolisthesis. At the same time, the surgery was not successful because she had a nerve injury. Because of my recommendation for her to have surgery, I felt responsible to find something that is more effective, safer, less invasive to treat her condition. And it turns out that the use of an endoscope to look at the pathoanatomy was the answer, because I could get to the pain generators in the spine without causing any damage to normal tissue. Because the endoscope comes in from the path of a needle, we have the ability to numb areas that may hurt. We can use therapeutic injections to reduce the pain. Then if I'm able to do that, I can put a dilator in a tube and a camera down the track of the needle to look for the cause of pain. This is the premise of what has developed over the last 20 years with the use of the endoscope. I had to develop my own system because systems out there did not allow me to see as clearly. So I created a system that we call the YES system that had distal irrigation at the end of the scope so that I can keep the area clear with the ability to see what's causing the pain. What's unique about DISC is really our ability to identify the cause of pain. Because of that, we offer the most broad spectrum of treatment options, including traditional techniques of fusion, disc replacement, and the newest techniques that are being developed. But ultimately, we come back down to what's causing the patient's pain. They're here for us to identify the source of their pain and to help them take care of it without just taking pain pills or doing therapy or doing injections that is dependent on the natural process to cure the problem. We have the ability to shorten the pain cycle by doing something to the source of pain without causing any damage to normal tissue. We have our own outpatient surgical facility that is only dedicated to the physicians here at DISC. We don't open it up to anyone else. This gives us the flexibility of doing our diagnostic injections, do our minimally invasive surgery for the sake of our patients and for their convenience. Here at DISC, we always place our patients first. It's my hope that by identifying the source of her pain, and if not eliminating it, reducing it, it'll help them get back their lives.